All right, so hello. This is our special video. It really is just for you. My name is Art Fuller. I'm with Access Services, and I work with a great team of screeners.
Hi, I'm Michelle Buchanan. I'm a nurse in the CCBHC, and this is my colleague, Kathy Eads, who's also in the CCBHC grant. We're going to talk today about common health issues in our communities that we see with comorbidity. The first disease we're going to talk about.
Let me make sure. Sometimes there's a little drag with the arrow. It's supposed to. Oh, is this not going? Look at that. It well, there it is. Okay, it just took a little while.
Okay, the first disease we're going to talk about that's very common among our consumers is diabetes. What is diabetes? Diabetes mellitus refers to a group of diseases that affect how your body uses blood sugar or glucose. Glucose is vital to your health because it is an important source of energy for cells that make up muscles and tissue. It is also the brain's main source of fuel. There are two types of diabetes. Type 1, which is juvenile onset, and type 2, which is adult onset. Diabetes kills 3 people every minute. There is no cure, just management. Signs and symptoms of diabetes. Consistent blood sugar greater than 110, an A1C level consistently greater than 6.5 or 7, increased thirst and urination, increased hunger, chronic tiredness, blurred vision, numbness or tingling in the hands or feet, wounds that don't heal, unexplained weight loss. These symptoms often develop slowly over the course of several years. It can be so mild that people may not even notice them. Treating diabetes is very diverse. Some people are treated with oral medications called metformin, which is 500 to 1,000 milligrams by mouth twice a day. If your primary care provider feels that you need insulin to control your blood sugar, there are many different types of insulin. Regular fast-acting insulin, long-acting insulin, and there are many name brands of insulin. Some come in vials, pens, or insulin pumps. One brand called Lantus cannot, I can't stress this enough, cannot be mixed with another type of insulin. It can cause a death. Insulin shots are given subcutaneously, and the patient should check their blood sugar before giving an insulin shot. They can check blood sugar by either a finger stick or an implanted device connected to a smartphone. What to do if you have a diabetic emergency. A diabetic emergency can be either hypo or low blood glucose or hyperglycemic high blood sugar glucose. To treat low blood sugar, you can give the patient an oral gel tube. It looks like this, and recheck their blood sugar in 30 minutes. If the patient becomes unconscious, you will have to give D50 by infusion if available, or call 911. To treat high blood sugar, give regular insulin subcutaneous as ordered by the primary care provider. Blood sugar should be checked 30 minutes after injection. If the patient becomes unconscious, call 911. If the blood sugar meter reads high, that means the blood sugar is greater than 600 milligrams per deciliter, which is a crisis and must be hospitalized. Statistics. Deaths per year are 79,535. More Americans die from diabetes than AIDS and breast cancer combined. Diabetes kills 3 people every minute. Next, comorbidity. We're going to talk about what is hypertension. Hypertension or high blood pressure is a condition in which the force of blood against the artery walls is too high. Usually hypertension is defined as blood pressure greater than 140/90 and considered severe if greater than 180/120. Hypertension is called the silent killer because it often has no symptoms. Over time, if untreated, it can cause heart conditions such as heart disease. Hypertension is the most common chronic condition that affects older adults. Treatment for hypertension. There are many different classes of drugs to treat hypertension. For example, ACE inhibitors, diuretics, beta blockers, calcium channel blockers, and vasodilators. What is a hypertensive crisis? It is a severe increase in blood pressure that can lead to a stroke. Extremely high blood pressure of a systolic reading of 180 milligrams of mercury or higher and a diastolic of 120 millimeters of mercury or higher can damage blood vessels. A hypertensive crisis can be treated with an oral dose of clonidine, usually 0.1 milligram to 0.3 milligrams. A very severe hypertension emergency must be treated in the hospital. Signs and symptoms of hypertension: severe chest pain, blurred vision, nausea and vomiting, severe anxiety, shortness of breath, seizures, and unresponsiveness. Severe hypertensive crisis treatments include hospitalization with oral or IV medications. Statistics: 1 in 3 adults have hypertension. There are over 3 million new U.S. cases of hypertension each year. 103 million U.S. adults have hypertension. The next comorbidity we're going to talk about, what is hyperlipidemia? It is a condition where there are fat particles or lipids in the blood. Example of lipids include cholesterol and triglycerides. These substances can deposit in blood vessel walls and restrict blood flow. This creates a risk of a heart attack and a stroke. LDL is the bad cholesterol that builds up inside your arteries. HDL, the good cholesterol that lowers your risk for heart disease. Triglycerides are another type of fat in the blood, and total cholesterol, a combination of the other 3 numbers. Your primary care provider will tell you when it's time to be tested for lipids in the blood, usually when you're on the wrong side of 40. Signs and symptoms. Hyperlipidemia has no signs or symptoms, but there is one simple sign that's very easy to spot. If a person has visible fat deposits underneath the eye, they most likely have hyperlipidemia. Hyperlipidemia is treatable, but it is a lifelong condition.
Sorry about that.
Ways to treat hyperlipidemia: a diet low in trans fat, saturated fat, and cholesterol. One way to remember if something has cholesterol in it is if whatever you're eating had a liver, it has cholesterol in it. Exercise regularly, eat more fiber-rich food, eat fish, avoid sugary drinks, avoid fried food, and avoid processed meat. Drugs used to treat hyperlipidemia. Drugs that prevent your liver from making cholesterol are known as statins. They are a good choice to lower the amount of cholesterol in your blood. There is also a drug that blocks cholesterol that you have eaten from being taken into your body by your intestine called cholesterol absorption inhibitors. They work in combination with statins. Examples of drugs: Zetia nicotinic acid also affects how your liver makes fats. It lowers your LDL cholesterol, triglycerides, and raises your HDL, good cholesterol. Fibrates are another kind of drug that works on your liver. They lower triglycerides and may boost HDL, but they aren't as good at bringing down your LDL. Consequences of not lowering your high cholesterol can be heart disease, stroke, angina, chest pain, blood clots, pulmonary embolism. These are serious, even life-threatening without medical treatment. Statistics: Nearly 29 million adults Americans have total cholesterol levels greater and higher than 240 milligrams per deciliter of blood. 7% of US children and adolescents 6 to 19 have high cholesterol. And because of the poor diet, these statistics will continue to rise. The next comorbidity disease we're going to talk about is coronary artery disease. Coronary artery disease is also called CAD, arteriosclerotic heart disease. It is a damage or disease of the heart's major blood vessels. The usual cause is the building up of plaque, which is the cholesterol. This causes coronary arteries to narrow, limiting blood flow to the heart. Because coronary artery disease often develops over decades, you might not notice a problem until you have a significant blockage or a heart attack. You can take steps to prevent and treat coronary artery disease. A healthy lifestyle can help a lot. Signs and symptoms. Chest pain, which can be treated with nitroglycerin tablets sublingually or buccally under the tongue or in the cheek. Angina, which can be treated with nitroglycerin tablets the same way. Shortness of breath, heart attack, smoking, hypertension, high cholesterol, diabetes or insulin resistance, not being active, your age, your sex. Most men are more likely to have coronary artery disease. Family history, high stress, overweight or obese, and poor diet. Consequences of having coronary artery disease. Limit your alcohol use to 1 drink per day. For some people, diet, exercise, and lifestyle changes may not be enough to lower cholesterol. Treatment. Treatment of coronary artery disease is a twofold process. Changing your lifestyle, quitting smoking, eating healthy foods, exercise regularly, lose excess weight, reduce stress. Various drugs can be used to treat coronary artery disease, including cholesterol modifying drugs, an 81 milligram dose of aspirin a day, blood thinners like Coumadin, beta blockers, metoprolol, calcium channel blockers, phenazine to help with the angina pain, nitroglycerin tablets, and ACE inhibitors. If you find the medications are not helping, there are procedures to restore and improve blood flow. First one is angioplasty, stent replacement. Coronary artery bypass, a heart surgeon creates a graft to bypass blocked coronary arteries using a vessel from other part of your body, which is usually a venule from your lower leg. Because this requires open heart surgery, it is most often reserved for people who have multiple narrowed coronary arteries. Consequences of having coronary artery disease. Heart attack, which could be fatal. Stroke, which could be fatal. Chest pain, shortness of breath, heart palpitations, dizziness, fast heart rate or tachycardia, nausea, sweating. These emergency situations and getting to the emergency room quickly will help the outcome of a coronary artery event. Statistics. Coronary artery disease is very prevalent. Nearly 48% or 121.5 million of all adults in the United States have some type of cardiovascular disease. And the last one we're going to talk about today is asthma. Asthma is a condition in which a person's airway become inflamed, narrow, swell, produce extra mucus, which makes it difficult to breathe. Asthma can be minor, or it can interfere with daily activities. In some cases, it may lead to a life-threatening attack. There are different types of asthma. Adult onset, allergic asthma, asthma COPD overlap, exercise-induced, bronchoconstriction, non-allergic asthma, occupational asthma. Asthma cannot be cured, but its symptoms can be controlled. Because asthma often changes over time, it's important that you work with your doctor to track your signs and symptoms and adjust your treatment as needed. Signs and symptoms of asthma are, they may vary from person to person. You may have infrequent asthma attacks, have symptoms only certain times, such as when asthma or, exercising, or have asthma symptoms all the time. Asthma signs and symptoms may include shortness of breath, chest tightening and pain, wheezing when exhaling, which is a common sign of asthma in children, trouble sleeping, caused by shortness of breath, coughing or wheezing that are worsened by a respiratory virus, such as the cold, the flu, and COVID. Asthma treatment. The right medication for you depends on a number of things: your age, symptoms, asthma triggers. What works best to keep your asthma under control? Pneumatic long-term control medicine reduces swelling or inflammation in your airways that leads to symptoms. Quick relief inhalers quickly open swollen airways that are limiting breathing. In some cases, allergy medications are necessary. What is an asthma crisis or attack? It is a sudden worsening of asthma signs and symptoms caused by the tightening of muscles around your airways, are also called bronchospasms. During an asthma attack, the lining of the airways also spasm. Some signs and symptoms of the asthma attack are severe wheezing when breathing both in and out, coughing that won't stop, tight neck and chest muscles called retractions, difficulty talking, feeling of panic and anxiety, pale, sweaty face, blue lips, fingertips, or gums. Worsening symptoms despite use of medications. Treatment. Rescue inhaler, breathing treatments, and oxygen therapy are all used to treat asthma. Common medications for asthma. Inhaled corticosteroids. These medicines may be need to use for several days to weeks before they reach their maximum benefit. Steroids, unlike oral steroids, inhaled steroids have a relatively low risk of serious side effects. There are many different types of medications used to treat asthma, from oral medication, inhaler, to breathing treatments. Treatment depends on your type of asthma. Your primary care provider will discuss and decide the best treatment for you. Statistics. Asthma affected an estimated 262 million people in 2019 and caused 461,000 deaths. People with asthma must work with their primary care provider to keep the disease under control. And that concludes our presentation on the comorbidity diseases we see.
So thank you very much, Ms. Michelle and Kathy, first for just taking the time with the presentation. This is a requirement for the CCBHC grant. This is one of our key goals. So if you have any questions and things, you can go back and look at the video, but do make sure you follow the instructions that came with this email that will record your official attendance and documentation that will be officially recorded for participation towards the CCBHC grant goals. Thank you very much. All right, that's it.